Hello friends, welcome to my new YouTube video about aphasia explained, what it is, causes, and how to communicate better. Let's start. Imagine waking up one morning and trying to speak, but the words won't come out. You know exactly what you want to say, but your brain and mouth aren't cooperating. Or maybe you hear someone talking, but the words don't make sense, leaving you confused and frustrated. This is the reality for millions of people living with aphasia. Aphasia is a language disorder that affects a person's ability to communicate effectively. It impacts speaking, understanding, reading, and writing, but it does not affect intelligence. People with aphasia still think clearly, have feelings, and understand the world. The challenge is expressing or comprehending language. Most often, aphasia occurs after a stroke, when a part of the brain is deprived of oxygen. Other causes include head injuries, brain tumors, infections, or neurodegenerative diseases like Alzheimer's and Parkinson's. It can appear suddenly and make daily communication overwhelming, both for the person affected and for their family. In this video, we will break down what aphasia is, its causes, types, and practical ways to communicate better. By the end, you'll have a clear understanding of how to support people living with aphasia. What is aphasia? Aphasia is a language disorder caused by brain damage. It affects the ability to speak, understand, read, or write. Importantly, aphasia does not affect intelligence. A person with aphasia can think clearly and reason normally, but their communication skills are impaired. Imagine your brain as a computer network. All the information is there, but the paths to communicate it are broken. Someone with aphasia may know exactly what they want to say, but struggle to form words, speak slowly, or use incorrect words. Others may speak fluently, but produce sentences that are confusing or nonsensical. There are two key areas in the brain responsible for language: Broca's area, controlling speech production, and Wernicke's area, controlling comprehension. Damage to Broca's area may result in slow, labored speech. Damage to Wernicke's area may cause fluent speech that is difficult to understand. Aphasia can be temporary or permanent, depending on the cause and severity. Early therapy and support can help people regain communication skills. Causes of aphasia. The primary cause of aphasia is stroke, when blood flow to the brain is blocked or reduced. Without oxygen, brain cells in the affected area die, which can disrupt language functions. Strokes that impact the left hemisphere of the brain, especially the areas controlling language, often result in aphasia. Other causes include traumatic brain injuries from accidents, which can damage language centers, and brain tumors, which put pressure on these areas. Infections like encephalitis or degenerative diseases like Alzheimer's and Parkinson's can also cause aphasia over time. It's important to recognize the risk factors for aphasia: high blood pressure, smoking, diabetes, and a history of stroke. Early treatment and rehabilitation are crucial to improving recovery and communication outcomes. How aphasia affects daily life. Living with aphasia affects everyday life in many ways. Simple tasks like ordering food, making phone calls, or writing emails become challenging. People with aphasia feel frustrated, anxious, or socially isolated because communication barriers make interactions stressful. Work life can also be affected. Someone who previously excelled in verbal communication may struggle to complete tasks that require speaking or reading. Family relationships may be strained if loved ones do not understand the condition or how to adapt their communication. Despite these challenges, people with aphasia can lead fulfilling lives with the right support. Social interaction, therapy, and patience from family and friends play a huge role in maintaining confidence and mental health. Understanding that aphasia affects expression, not intelligence, is key to empathy and effective support. Awareness is the first step. By learning about aphasia, supporting communication efforts, and encouraging therapy, we can make life easier and more inclusive for those affected. Every word, gesture, or visual cue can make a difference. If you know someone with aphasia, be patient, listen actively, and focus on their message rather than their difficulty in expressing it. And remember, your empathy and support are just as important as therapy in helping them regain confidence and independence. Please subscribe our Guardian Home Care YouTube channel to get more videos. See you soon. Bye.